Hello everybody. Today I'm going to talk to you about the emerging opportunities in public health sectors.
Hey, don't forget to subscribe to this channel and also tap the bell icon to get continuous updates on forthcoming videos.
Why do we do public health to begin with? Is it because we are motivated by the best of intentions? Is it because we want to make money? Or is it because we are motivated by the ideals of service? To each of us, we might have different answers of why we are in the field of public health. But now that we are in the field of public health, what's essential is that what opportunities exist for each of us, and how do we build the space or build our brand in public health and global health. There are many ways to do it. To begin with, while we are studying our masters in public health, or if we are pursuing any other discipline such as MD community medicine or family medicine, or we're doing a PhD as an interdisciplinary or a focused PhD in public health, we need to first achieve skill sets that make us industry ready. If we don't have the skill sets in public health, we have already missed the bus. Once you miss the bus, career opportunities and scope narrows down pretty much. That is why building your brand in public health is directly tied to skill sets. Once you have achieved all the skill sets possible, then sky is the limit. It might be that you want to work as an academician in the field of public health. You might want to be a researcher attached to research institutions in the field of public health. You might want to be a development sector trainer who is engaged in continuous training in public health. It may also turn out that you might want to do monitoring and evaluation in the field. You might want to implement some programs on the ground. You might want to work with inter-country organizations building policy mandates. Or you might also want to migrate to low and middle income countries with very challenging environments and then work in the space not just of public health but also in the space of climate change, migration, gender concerns, refugees, and maybe war zones. What's your motivation for it is a question that you need to answer yourself. But the scope that the field has to offer is huge, and how you tap into that scope is also something that you will have to work on. Some of your colleagues might tell you, okay, there are some websites where you find jobs, you can apply in some places, you can put in your CVs in different platforms, but that's not going to attract attention, that's not going to attract your talent. What is going to attract your talent is how well have you navigated the space of public health. That is going to catch the attention of people interested to hire you. So what I would recommend is that when you're spacing out your life and your career in the space of public health, decide what is it that you want to spend your life on, or where do you see yourself in the next 5 years, in the next 10 years. Do you envision yourself as an academician who is teaching public health to students of different disciplines? Do you envision yourself working in an NGO or a non-profit, working in middle of communities? If that is so, how long do you think you can do it? And how many years do you want to do that? Do you want to live in a tier 2, tier 3 city and build that core public health and rural development that is the missing link in our systems and processes of governance? Or do you want to sit in an air conditioned cabin doing some kind of research, maybe desk based, maybe partially desk based, partially field based? Or do you want to live internationally, travel around the world, work with international organizations, and build the policy space across countries? To all of this that you want to do, you'll have to identify a niche area. When I mean identify a niche area, it's you can't be one day doing infectious diseases, another day doing non-communicable diseases, another day doing something else. You need to have at least 2 or 3 areas that are your core, wherein you've at least had sizable amount of publications, you've had sizable amount of exposure, you've done sizable amount of work on the ground, you've attended workshops, you've taken workshops, you've been given guest lectures. This is how you build who you are and what you can be to the space of global health and public health. So what do you need to then do while you're studying or while you're coming to the end of your educational qualifications is you need to identify who are the stakeholders working in which sector, what domains, how are they operating, is that something that vibes with your passion, and is that something of your wavelength? Can you tolerate those processes of stress? That's something you need to look into and think through of what essentially can be done from a perspective of how you want to build your life. I get a lot of applications from youngsters who want jobs, who are on the lookout for guidance. But what is missing in this process is nothing that I tell them is ever implemented. I don't know if that's an unfortunate part of our grooming, or that's an unfortunate tragedy of how we are or how we approach professional excellence. But without possessing certain domains of skills and talents, the scope of public health also gets very narrowed. I mean, finishing a master's degree, wanting to migrate abroad, wanting job opportunities in different countries, or wanting to do a PhD, all of that is possible. I mean, I don't want to walk you through rigid systems saying that, okay, these are your options available, this is what you need to do. No. That's not how the world works. That's not how you should work. That's why I'm not talking to you even with a PowerPoint presentation. You need to orient your thought processes and mindset into understanding yourself first before you can do something for others. There are a lot of people who try to do public health, go to the field, then feel very lonely about it, then go into depression, have anxiety issues, and then want to quit either the sector or want to quit that job and move on to something else. So the starting point of all of this is, what is it that I as a person what is it that I as an individual is capable of doing. There is absolutely no point trying to compare yourself with another individual, because their circumstances, their social upbringing, their cultural values, their religious preferences, their outlook at life changes from person to person and can never be something that gets into an experience of your own. Every individual is unique, so you will need to write your own story of public health. Question is, how are you going to write it, and how hard are you working for or willing to really do the kind of changes that you need to bring in your life to get to where you want to go. The first few years of your life, probably while your energies are still fairly great, I would recommend working in the field, understanding different geographies, different government systems, how is they approaching the things of on ground national programs, how is different integrated programs like disaster management, like road traffic injuries, like mental health, narcotics, how are these integrated programs working, getting a feel of how it is to operate in a complicated society like ours. This will give you insight into how you can then probably shape parameters pertaining to research, capacity building, how you can probably do program implementation on the ground, what works and what doesn't work. These are lessons and learnings and best practices which you will eventually come to know only by getting your hands dirty on the ground. It is very easy to read few textbooks, attend some lectures, absolutely easy. But the real world work of how public health is, or how public health is to be done, can only be understood by somebody willing to go to the ground. And going to the ground doesn't mean like you go and visit a primary health center, or you go and visit a Anganwadi, or you go and visit a sub center, or you go and visit a sewage treatment plant or something like that. No, that is not how you will ever approach the discipline of building your skill sets and narratives in public health. You need to be part of a program. You need to be implementing something. You need to understand what are the objectives, tangible goals, and outcomes envisaged for that program. Only then will you be able to even relate to what does it look like, or what does it really mean to do research in this field, or what does it really mean to write a grant and raise funds, or what does it really mean to work for a community X, Y, and Z, of how you improvise certain systems. Once you gain that necessary field experience, then you can really branch out into anything you really want to do or how you want to live your life. Then there's no looking back. But getting that kind of field experience is very important. If you don't have that field experience, how are you going to make policies that really work on the ground? Doesn't make any sense. What differentiates you then from a bureaucrat and a public health technically skilled person? At least bureaucrats have that turf knowledge because of by nature being posted in a district. But if as a public health professional you don't even work in a district, where are you going to go from there? Sometimes I meet a lot of passionate youngsters saying that मुझे ना job करना है in World Health Organization. I want to sit in the Geneva office of WHO. That's nice. But WHO doesn't really want you. WHO doesn't really work the way you think. And lastly, WHO doesn't even care. So we need to understand how are we influencing that change which really matters. Even if you've been able to change 10 lives on the ground for the greater good of humanity, I feel you've met with exceptional success. And this is how the whole scope of public health and the whole entire window of public health will then start to open to you. A lot of time what happens is when people finish their masters, their credentials are only that they have a degree, they finished their masters. And then when I ask them the next question, how many publications you have? Zero. How many books have you written? Zero. How many conferences you've attended? Maybe one or two. And then they say that our teachers don't encourage. Conveniently, the blame is shifted on the staff or faculty saying they don't encourage us. Or on the university saying the university has a lot of attendance issues. But my question here is, have you made an attempt? Have you documented that attempt? If you made an attempt and they have still not encouraged you, then there's a problem. But if you've never made an attempt and you've assumed that they've not encouraged you, then that's something wrong, and that's a wrong mindset. You can get an opportunity to work anywhere you want. You can work in an NGO sector, you can work in the development sector in the UN, you can work in government departments, you can work in research-based institutions, you can work in corporate companies, you can work in data analytic firms. Anywhere you want, you can work. You will also get a job. That's how big the market is. But you will be judged. Your competence and skill sets will be judged. Don't be under the impression that, okay, merely getting a degree, your life is sorted. No, that's not how industry works, and that's also not how anybody in the sector would want to welcome you on. What is required is the niche that you have, the niche skill sets that you bring to the table. That opens the window of scope for opportunities that you can tap into. Additionally, also what is important while you're exploring opportunities in public health is the kind of reading that you do. What type of reading, whether it's books, whether it's journals, whether it's popular online blogs, what type of reading do you do to nurture and nourish your intellectual ability in public health? That's very important. Reading one or two basic textbooks, anybody does that. But reading something of intellectual value and implementing that whole thing into action, that differentiates your skill sets and talent on the ground. Otherwise, getting a 9 to 5 job, you'll find anywhere. Probably you'll negotiate for some pay scales also. But ask yourself, does this make you happy end of the day? Does this satisfy you? Would you look up to something like this saying, oh, it's a Monday morning, I need to go to job? Or would you come out with passionate energy saying that, okay, today is a new day, there's a new energy, it's a magical morning to tap into, and let's see what I can do for the world. Based on how you're getting the answers to the questions you raise, this will also bring out the kind of personality you are. This will also lead you to suggest, saying, okay, this is the kind of career I want for myself, this is not what I like, this is what I like. And then you'll be able to filter, saying, okay, 5 years to 10 years from now, I would like to see myself in this place. When you have absolute clarity in this aspect, sky is the scope for public health. I wish you good luck in all that you do, and hopefully we'll meet again in some other forum. Thank you. Bye bye.